So as we know, this coronavirus epidemic has really had a serious effect on all of our lives, but maybe most of all, healthcare workers have been hit hard by this epidemic, now pandemic crisis. So I wanted to bring together three people who really could speak to different aspects of that impact. We have with us today Esther Zhao Yafang, who's a medical student from China doing research related to her doctoral thesis at the Yale School of Public Health. And we also have Emmy Yang, who is a medical student doing the Duke Divinity School program on theology, medicine, and culture. And also with us today, a psychiatry fellow at Yale, Eunice Yuen. So let's start with Esther. Esther, what can you tell us about the Chinese healthcare workers' experience early on in this epidemic and how that has played out?
Okay, yes. So I want to share my screen. Yeah, this one. Okay. Can everybody see the PowerPoint, the slides?
Mm-hmm.
Okay, fine. So as we just saw a short skit, the short skit is adapted from some real stories of epidemic prevention in Wuhan. The aim of showing this skit in public is we would like to cause everyone and is sitting in front of the screens and not just the doctors and nurses to think about as a healthcare workers when we are facing the real risk and have to make ethical decisions. What is your choice? On the one hand, are the roles and responsibilities on our shoulders, and on the other hand, it's concern about our families, ourselves, and the future. Where do we go from here? At the beginning of the epidemic, many doctors and nurses have volunteered to the front line to fight against the uncommon disease. And for China's most famous hospitals, has sent their medical staff to Wuhan to help control the epidemics. At the first time, each step is difficult, it's tough, because the healthcare workers, it's just like the general public. They had limited knowledge of coping the novel disease. They also faced the overloaded work and need to wear protective clothing and equipment from the beginning until the end. So I from my opinion that the healthcare workers, they are all ordinary people like us, and under some difficulties or facing the risk, they could be and have the right to fear of something the unknown or uncertain things. But they could be afraid, but they never flinch. So yeah. Fight against the epidemic is very hard and tough. The stress events could impact on both psychological and physical health of the healthcare providers. And the ordinary people in Wuhan, they are so warm and they're trying their best to treat the healthcare workers with their hometown gourmets. Just want to give the both materials and mental health support to comfort the soldiers at the first line. So as we know that many medical students and medical workers, they cannot be in Wuhan, but they use their own ways to help people just to overcoming some fears or uncomfortable feelings. We could see that some doctors and professors, they use their knowledge and skill and the humor to appease ordinary people, just to tell them to be staying calm and tell them how to protect themselves. They're also very brave and courage people. And so far, the epidemic in China has greatly improved compared with 3 months ago. And the last square cabin hospital in Wuhan was closed. And on March 17, just a few days ago, support medical team evacuated Wuhan in batches. But some people, they're still fighting. They will never end until the that everyone has overcome this disease and everything go back to the normal. So if we compare the COVID with the Ebola, the challenges we faced are more tough. But the lucky and the most important thing is there was a lot of heroic work by the healthcare workers. The truth is the medical person, they also have physical bodies and are more at risk than we are in some situations. They could be worried, but they will do their best to help those suffering. So I think from my perspective, we could take this pandemic crisis as an opportunity to understand more about the healthcare providers and try to think of things from their perspective. I believe we can all be encouraged and draw hope from some of these stories in our own countries and around the world. So thank you for your listening, and I hope those informations or what I share will make you feel better and make you feel courage to fight against the disease. Okay, I'm done.
Thank you so much, Esther. And I'm wondering that last part about hope, that might actually relate to some thoughts that Emmy has on this. Emmy's studying the sort of theological perspective on what's happening during this epidemic. So Emmy, what thoughts do you have maybe more broadly on healthcare workers and how they've been impacted during this time?
Yeah, absolutely. Thank you, Esther. I'm going to start by talking about the topic of vocation and why I was drawn to medicine. So I was drawn to medicine because I wanted to come alongside individuals in times of suffering and vulnerability. And to this day, I believe that that's what keeps me in the path of training. But I can say for certain that my pre-med self did not know exactly what I was signing up for. And I'm not sure any of us do. I think of the doctors in Wuhan who couldn't have anticipated wards overflowing with COVID patients in respiratory distress, or the Italian doctors having a shortage of ventilators, or American doctors now suddenly questioning whether or not they can go home to their families. I think of the interns who started residency this year at Yale New Haven and hospitals around the country who are now faced with the task of caring for the contagious ill. What does it mean to be called to a service which threatens your and your family's health? Doctors and healthcare professionals at large are in vocations with commitments towards the sick. This is a commitment vocalized at white coat ceremonies across the country, and an oath taken. These oaths are often adaptations of the Hippocratic Oath written in the 4th century BC. But this is a time when that commitment is surely being tested in unprecedented ways in our generation. This is, as a Duke physician shared with me, a generation-defining moment, and one that we have the capacity to shape. First, we must recognize our vocational commitments in contagion, whether that is to be a frontline staff or caring for those remotely. The theologian and Reformation leader, Martin Luther, in a letter entitled, "Whether One May Flee from a Deadly Plague," writes during a 16th century reemergence of the bubonic plague in Germany, when many citizens wondered whether or not it was faithful for them as Christians to leave their town behind. Those who are in a professional position of service to others must stay, he says, including public officials, judges, and physicians working for the city. He identifies church leaders as having a role in ministering to the sick and dying. He even mentions parents as having obligations to their children, which is to say that each and every one of us has a role to play in contagion. And that role need not be in the emergency departments or by the bedside. Sometimes our role in contagion is simply to stay where we are and not do the things that we are used to, especially as we've learned from China that social distancing and suspension of domestic and international travel can and will minimize the spread of the virus. I speak personally to say that not doing right now is very hard. I speak myself when I say that I feel a sense of guilt for not being a first responder or in a directly patient-facing role in this time. The year that this plague hit us is the year that I'm in divinity school, far away from New York City, where many of my friends remain. So I speak wanting you to know that you are not alone in your feelings of guilt, fear, or grieving. I grieve for the losses of lives in China, Italy, Iran, Korea, the US, and all the places that do not get named by popular media. I grieve for your losses as students, workers, and trainees, the personal and corporate sacrifices you are making. And I want to share how heartened I am by the very existence of a panel like this, how heartened I am by how many people are praying around the world for those affected by COVID. I think it is important that we remember that though we must be fastidious in taking precautions, we are first humans, as are those infected or sick from the coronavirus. Just as the patient is a human with diabetes, multiple sclerosis, or colon carcinoma is not their disease, neither are people the infections that they carry. And practitioners will continue to care for those infected, though at a risk to themselves, because their patients are first human beings. And we as a people will continue to care for one another at a physical distance, but very much in relational proximity. A pandemic cannot take that away, for love and gentle words transcend all time and space.
Thank you so much, Emmy, for that thoughtful presentation. And Eunice, I'm wondering if from your profession, you might have any personal insights to share as a psychiatry fellow who's in this.
Yeah, thank you so much. And I think my personal feeling and experience right now, it actually resonates a lot to what was discussed by the other two. I think right now is such a unique and vulnerable time of history of actually throughout our training. And that certainly provoke a lot of feelings. Those feelings could be overwhelming without us sorting out what it is exactly. It could be really overwhelming. It's really confusing, and especially what we talked about just now, that like we are handling so many different hats in our life, that on one hand, our passion and mission to what draw us to medicine is really like, you know, do no harm, what would be the best interest to our patient and family. On the other hand, we have, at the same time, we have the hats about what could be the best interest for us to look out for ourselves, for our family, and the loved ones. And thinking about those hats when they have conflict to one another, the interest and priority are kind of like conflict from one another, that create a sense of insecure, confusion, and it just like sometimes we have to be honest to ourselves, and sometimes physician like perhaps we really lack of the role, lack of the safe space to speak to those feelings, to be like to tell ourselves like it is okay to be vulnerable, to admit that we are also human beings. We all feel the same way that everyone feel, rather than the conundrum about hero complex. Should I be the hero to save life versus like, should I be the hero for my family and for myself? Should I give the mask to myself before everybody else first, so I can save myself before saving others, that in such a period with limited resources? What would be the question? I think these, like, we need to think through this for every healthcare provider, not only, in Asia, but also all around the world right now in US. Well, these are some really important questions. We need to think through this by ourselves, but also together as a group, that we need to be cohesive together to support each other, to be okay to share those vulnerable feelings, rather than having implicit expectation by self, by peers, or by patient. I think if we candidly, sincerely share these feelings with our colleague or patient, everyone can understand that. Everyone can be empathize about that. And lastly, I hope that this message can, share with many of our healthcare providers right now who are, challenged by these thinking and feelings. And at the same time, while we could be the person in the front line doing things that we're supposed to be, but also being okay to talk about we are vulnerable as human, as everybody else. Thank you.
Thank you all so much. I appreciate the perspective you brought to this, and I hope people viewing this video found your presentations thought-provoking as well.